For a complete neonatal resuscitation in the delivery room, in an initial evaluation must be performed that is based on the answer to four questions. If all the answers are affirmative, the newborn can be placed skin to skin with his mother, and if necessary, he can towel dry and clean to mouth with gauze. In the initial assessment in not affirmative, act in the following order, except in the case of mechanical amniotic fluid.
Avoid air loss, optimize the airways, dry the skin with pre-heat towel, removing the wet towels and covering it with a dry one, tactile simulation, reposition, evaluate bright, heat rate and color. In case of persistent cyanosis, consider supplement oxygen. In case of apnea and air rather less than 100 plus positive pressure ventilation, start cardiac massage at any time if 3 is an abscess of hair bed or a hair rather of less than 60 after 30 seconds of positive pressure ventilation.
Technique. Place the thumb on the lower tier of the sternum below the intermammillary line, and the rest of the fingers hugs the chest. Another way is to compress at the same point with two fingers placed perpendicular to sternum. This technique may be more useful in the case of a single recur. The compression depth should be 1 out of 3 of the anteroposterior diameter of the chest. The compression ventilation rate should be 3 compressions followed by ventilation. After 30 seconds of ventilation and cardiac massage, assess the heart rate.
Well, I will now explain the cardiopulmonary resuscitation in the pediatric patient. The first step is to check the ECG, then check if the patient is breathing and take a pulse for 10 seconds, mainly in the carotid artery. If no pulse is felt and those do not respond, the emergency system should be activated and CPR should be started and series of 15 compressions and 2 breaths will be performed. Generally, the compressions in the pediatric patients will be done with one hand, and if it is already both hands will be used to use of the defibrillator will also be necessary. Among the drugs used in pediatric resuscitation is epinephrine, amiodarone, and lidocaine.